Hi everybody, welcome to Healthline. I'm Gregory Zarian. So it is February, which means it is Heart Health Month. So how healthy is your heart? Couple statistics. The average beats per minute for an average heart is 80 beats per minute. So that means your heart beats about 4,800 times per hour, and that's a whopping 115,000 times per day. So how much do you do with your heart? Do you work out? Do you run? Do you jog? Or do you do nothing? Do you sit sedentary? What are the signs and symptoms of a heart attack? Are they the same for a woman and a man? Joining us from Adventist Health Glendale is Dr. Armand Rostamian. He's going to share with us all we need to know about the hardest working muscle in our body. Welcome, doctor.
Thank you.
It's your first time here.
It is, yeah. Pleasure being here, and thank you for having me.
Glad you're here, and my heart says this back to you. First of all, tell us, give us a little bit of medical history in regards to your background.
Sure. I'm actually originally from Glendale, and I went to college at UC San Diego. Okay. And I went to medical school there as well. I trained at Cedars-Sinai for internal medicine, and I went to UC San Diego, went back down for cardiology training, and after that I've come back up to the LA area.
And welcome back to Glendale.
Thank you, thank you.
You know what they say about those Glendale people? Yay, us. What is it about the heart in you, and why is that your specialty?
Yeah, so actually I started doing research when I was in college on the cardiovascular system. Okay. And it was I kind of met some people, started doing research, and I loved it. And from that point on, it just picked up. And I did a lot of research and publications in all spectrums of cardiology. And so I really took a liking to cardiac imaging. And for that reason, I'm multiple board certified in all types of cardiac imaging, CT, nuclear, echocardiography, and I actually do specific intraprocedural imaging for advanced cardiac procedures. So I'm there doing the imaging during the testing. That's awesome.
Yeah. Before we head off to our first break, how strong is the human heart?
The heart is very strong, and it's very durable. The heart actually beats many times a day, as you had mentioned. It is a muscle, so just like when you go work out your biceps, as the heart works out more and more, you can get a bit of a thicker heart. And that's why athletes tend to have a more vigorous heart with a lower heart rate. Their heart rate goes down because their heart is pumping stronger. So heart rate can be a sign of heart health as well, if it's a lower heart rate. Lance Armstrong, he lives in the 30s, heart rate of 30s, which is really unusual. We don't usually see that. But yeah, the heart's very strong, and it can get conditioned as well.
More with heart health, and how do you take care of your heart? And again, what are the signs and symptoms of a heart attack? Are they the same for a man and a woman? And we always hear about baby aspirin. Does it work on everybody? Those answers when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian. Here are some heart attack statistics. 1.5 million heart attacks occur in the United States each year, which equals 500,000 deaths. That's more than 23,000 women die annually from cardiovascular disease. A heart attack occurs about every 20 seconds, with a heart attack death about every minute. So almost 14 million Americans have a history of heart attack or angina. Joining us from Adventist Health Glendale is Dr. Armand Rostamian. Doctor, those statistics are really high. Is it on us, or is it hereditary?
Yeah, that's a great question. There is a hereditary component. And, you know, to tell you the truth, the heart wasn't meant to live for 70, 80, 90 years. People's lifespan were 40, 50 years previously, but because of advances in medicine, we could live a lot longer. So now we're dealing with chronic issues with the heart. And that's why we really need to take care of it throughout the entirety of our lives, not just towards the tail end. The numbers are astounding, and part of that is because we really need to put a bit more focus on preventive care. I love that. Meaning, you know, control of cholesterol, control of other modifiable factors, what we call them, meaning you don't smoke, good diet, exercise, And so we try to do all of this to overcome any type of genetic predisposition we might have, because the genes we can't change, but the other things, such as those factors I talked about, we can, and we really need to be able to balance out the two.
Because Bill, here's the thing though. Before we talked about, like you said, the heart is very durable. It's very strong, and we were talking about Lance Armstrong and athletes, and it's a muscle, so we can build up our muscles. But then on the flip side, if you don't take care of your heart, it can then become really weak.
Yeah, absolutely. And when you're dealing with things like heart attack, that's a sudden hit to the heart. But there are other things that we consider, such as chronically high blood pressure.
Okay, so chronically high blood pressure, it's stress. What do you believe are the number one reasons for high blood pressure? Chronically high blood pressure.
Yeah, a lot of it's genetic.
Okay.
But you know, people tend to get diabetes, and diabetes is pretty rampant in our country. And high blood pressure and diabetes run hand in hand. There are a lot of causes for high blood pressure, but really it's a very common condition and something that a lot of people are dealing with. Most likely there's some kind of genetic predisposition there. But high blood pressure in and of itself isn't horrible as long as it's controlled. And we call it the silent killer, because when blood pressure is elevated, most people don't feel it. Some people say, oh, I feel a little nauseous or headache, but a lot of people don't feel high blood pressure, especially when it's been high for a very long time. So for that reason, it can take an effect on the heart, the brain, the kidneys, every single part of your body, and you won't even know until it's too late.
I hate that you said, isn't there something, it's called, and for women it's called the widowmaker, right?
Yeah, the widowmaker is for men or women.
For men and women.
Yeah,
okay.
it's actually, the widowmaker is the LAD, or the left anterior descending artery of the heart.
Okay.
So the LAD is one of the vessels, that's one of the main vessels. And what they call it the widowmaker, because if you have a heart attack in that artery, there's a high chance that someone could pass away from it. So for that reason, it's crucial that if someone begins to develop any symptoms of a heart attack, they go right into the emergency department.
So let's dive into that. Signs and symptoms for a heart attack are different with men and women. True?
They can be, yes.
But then again, they're also similar?
Yeah, so
what are the similarities? Let's start with that.
Yeah, so the typical signs of a heart attack are having a either left-sided or central chest discomfort. That could be a pressure, it could be a pain, it could be a...
But it's not a muscle pull or a tear. Like, if somebody works out too hard, they're like, oh, I'm hurting over here, and it's probably maybe a muscle or a tear. It's deeper.
It can be deeper, but sometimes that could be a fake out. And
okay.
Sometimes we do an entire cardiac workup and we find out that everything's normal, but it was the muscle that was the problem.
Got it.
So it can be difficult to differentiate, and that's why we really rely heavily on labs, EKGs, any studies, imaging studies for the heart, and really other associated symptoms. So for example, if your chest pain radiates down the arm, that's more concerning, or goes to the neck. Or if you have nausea or vomiting or sweating with it or shortness of breath.
Okay, in regards to the sweating, is it a cold sweat? Is it a warm sweat? It
can be either. And it could just be a little bit of sweating. Okay. It's very, there's no specific diagnostic criteria for these things. These are just kind of an overall clinical picture we look at when we're assessing somebody. And those are the typical symptoms. And usually chest pain from the heart comes on when you exert yourself. And then when you stop, it goes away. But if it's happening at rest, it could be a heart attack.
Okay.
And that's very concerning.
But go back though, when you say exerting yourself, could that also exerting yourself with the pain going down the arm and going up towards your neck? That could also be a heart attack.
Yes, that could be a heart attack, and we call that unstable angina.
Got it.
Is a technical term for it, and that's when it gets worse and worse in terms of frequency or intensity.
Okay.
That is a concerning sign.
But then also when you're sitting at rest.
That is also very concerning. So if anyone is having any symptoms such as the ones I described, those are very concerning. How chronic are the symptoms? Because sometimes you could move and be like, oh, that hurts, and it goes away. Right.
When do you start paying attention to that, thinking, okay, I'm possibly having a heart attack?
If it's a little twinge for a second or two, which some patients come to me and say, oh, I had a little bit of twinge, it was just lasted for a second, went away.
Which is never wrong. Like,
it's not.
It's better to go see your doctor and have them say you are great.
Absolutely. Now that is probably less likely to be from the heart. I can't say for sure, but less likely, and that's when we would run further tests. Really the really concerning signs are when someone's getting the chest discomfort when they exert themselves, and it goes away when they rest. Those are classic signs.
Okay.
But you can have what's called atypical presentation.
Okay.
Atypical symptoms, and that's more in your females and diabetics.
Got it.
And you can have any type of symptom, really. It's really nonspecific. Even things like heartburn can be a result of cardiac chest pain. And for that reason, if something is out of the ordinary, it's very, very important to be able to go see your doctor right away or go to the emergency department to be evaluated. Because when we say in cardiology, time is myocardium, meaning time is heart tissue. The longer you wait, if you're having a heart attack, the more tissue dies.
Well, it's also the same thing with stroke. Time loss is brain loss. More with Dr. Rostamian when we come back. Don't go away. Welcome back. Happy Heart Health Month. Statistically, one more time, 1.5 million heart attacks occur in the United States each year, with 500,000 deaths. More than 233,000 women die annually from cardiovascular disease. Joining us from Adventist Health Glendale is Dr. Armand Rostamian, cardiologist. Doctor, why more women than men?
There are slightly more women in the population than men.
Okay.
But also we have to keep in mind that as our population ages, there are certain factors that we have to take into account. Actually being postmenopausal is a risk factor for having a heart attack as well. Yes. And women over the age of 55 have a higher risk for heart attack. Men over the age of 45 have a higher risk for heart attack. But those numbers tend to balance out because of the postmenopausal risk factor.
Okay. Are there any other signs and symptoms? Because I know we talked about earlier. We talked about the pain going down the left side. Nothing happens on the right side.
It can.
Okay.
It can. And that's again.
It's the same for men and women.
Yes, and it could be atypical for women, where we say, oh, their chest pain was actually a heartburn sensation, or just the shoulder pain.
Okay.
There's all types of presentations that we've seen. I had a diabetic come in who was having a heart attack who had no chest pain.
Okay.
And that's because with diabetes, if it's really poorly controlled, the nerves that innervate the heart and the surrounding tissues actually become desensitized.
Okay.
So you can have all types of presentations with the heart. That's why it's very important if something is happening that seems concerning to the patient. I always tell the patient, if it's concerning to you, you need to get checked out right away.
More than once? More than one time? Or like if something happens, because we all have moments where we're like, oh, that hurts, and then it goes away.
Yeah, so if it's just a second or two and it's a quick twinge and just goes away, I usually don't make too much of that.
Okay.
Now, if somebody is having those on repeated occasions or is unable to exert themselves or perform any exercise, now I'm more concerned. That's why when they come in, we do a full evaluation, and that's, we usually start with an electrocardiogram with the leads. We'll do some labs and check their cholesterol and all the other risk factors, check for diabetes, and we might do some imaging if it's needed.
And one thing that's important too, and we say this all the time here on Healthline, is have in your wallet, women have in your purse, or have on your person, or give it to a partner, husband, wife, or whatever, the medications you're taking. Family history, mom, dad, hereditary. So when a patient is brought in to see you or into the ER emergency, you know exactly what you're dealing with.
Absolutely, you're very, very right. That's correct.
And your blood type. Super important, your blood type.
Yeah, I mean, if I'm seeing a medication list, and a lot of times this happens, patients just don't know their history, unfortunately. And if I'm seeing a medication list with a lot of heart medications there that look like they're for angina, well, my suspicion is going up now, and I explore that further. And unfortunately, a lot of patients don't know their history. So
Sure.
It's very important what you mentioned. Absolutely.
And when you say angina, can you share with everybody what that is?
Angina is chest discomfort from the heart.
Got it.
Yeah.
So someone comes in and they, in fact, are having a heart attack, and also know exactly what hospital you want to go to. So when you call emergency, aren't we a certified heart hospital?
Correct, yes. Adventist Health Glendale is a certified heart hospital. We do have a STEMI program, meaning that if someone is having an active heart attack, we have very quick means to get them to the proper testing, which is an angiogram of the heart, and open up the artery as quickly as possible. We have specific time limits that we have to meet to be able to get that patient in as quickly as possible, because like we mentioned, time equals muscle. So the longer you wait on a heart attack, the more muscle dies, and that's why it's very important not to ignore any symptoms.
And also, if you feel like you're having a heart attack, don't drive yourself. So somebody comes in and they are in fact having a heart attack. What is the protocol?
So initially the EKG is the first thing that's done. They will also draw labs, but the labs might not show anything. The EKG is crucial, and the evaluation of the patient's symptoms. Now, if there is an active heart attack occurring, a cardiologist will be involved right away. If there is what we call a STEMI, meaning a massive heart attack, then everything is rushed. The on-call team comes in right away. The interventional cardiologist comes in right away. They will go ahead and do the angiogram within 90 minutes. That's the goal. And open up any artery if it is blocked.
There's a lot of conversation these days about a lot of people are getting stents, and they're going in, and normally when you think of heart surgery, we think about cracking the chest open and going in that way. What are your thoughts on all of that?
Yeah, so whenever we do an angiogram of the heart to see how much disease there is in the arteries, I tell all my patients there are three possibilities. Either we're going to go in and we're not going to see much disease at all, just minimal disease. The other possibility.
And when you say disease, you're saying heart disease?
Disease in the arteries of the heart.
Got it.
Cholesterol plaque. The second possibility is we could go in there and see one or two arteries that are narrowed, and for that we can actually stent at the time, meaning they could place we could balloon open the artery, so we open up that narrowing, and we place a stent so that it stays open. And the third possibility is that there's so much disease there that we can't open up every individual artery, and so the patient recovers and they undergo an evaluation for an open heart surgery with a bypass, and that's by the surgeon. And sometimes they're too high risk for a surgery. Then we could consider opening certain arteries with stents, yes.
Got it.
There needs to be an indication for stenting, whether that's symptoms, a weak heart, or a heart attack, among other specific indications. But we don't usually go in there and just open up any arteries we see. Sometimes patients are doing just fine, and we treat them with medications. And there was actually a recent trial that came out that suggested that medical therapy and stenting may potentially be equivalent in the long run. But again, these are a little bit more controversial issues in cardiology, and really need to defer on the expertise of the cardiologist who's evaluating the patient.
And each case is specific to the patient.
Correct.
More Dr. Rostamian when we come back. Don't go away. Welcome back. Adventist Health Glendale has been recognized by U.S. News and World Report as one of the best hospitals for 2019-2020, ranking 10 out of 133 hospitals in Los Angeles and 17 out of the 414 hospitals in California. Adventist Health Glendale recently received its 10th, I'll say it again, its 10th A grade in a row for patient safety from the Leapfrog Group. The conversation today is all about heart health, signs and symptoms of a heart attack, and also how you need to keep your heart healthy. Joining us from Adventist Health Glendale is Dr. Armand Rostamian, cardiologist. Doctor, so being very transparent, I, in the past couple of years, lost 30 pounds. I quit smoking. February 25th will be 15 years ago.
Congratulations.
I am really healthy. I work out, I do yoga, I spin. I'm really healthy lifestyle forward. Recovered off of shoulder surgery, so post-op blood tests, and my doctor said, your triglycerides are really high. Yeah, my triglycerides are high. My VLDL, is that right? Mm-hmm. VLDL is super high, and he wanted to put me on a statin. There's a part of me that doesn't want to be on a statin because I don't like side effects, and I heard there could possibly be joint pain, this pain, that pain. How come I have such high cholesterol and I'm that healthy?
Yeah, so It's great that you did all that because you are reducing your risk for cardiovascular disease.
Okay.
Stopping smoking, exercising, these are all incredibly important.
And I quit drinking.
Not drinking, that's very important. So, just as a fun fact, stopping smoking, you're still at a higher risk for cardiovascular disease for about 3 years,
Okay.
based on studies. After that, it's reduced. But sometimes we deal with genetics. And
So it's a gift that mom and dad gave me.
a bad gift, I guess,
Okay.
a charcoal from Santa.
Thank you, Santa.
But, those are things that we can't change, unfortunately, by doing regular exercise, diet. Diet's also very important, and that will help. So
Okay.
when we're looking at a patient who has bad cholesterol, number one, we look at the cholesterol panel.
Okay.
So there's a good cholesterol, which is the HDL.
Okay.
That should be actually high. It's protective against cardiovascular
Okay, I
disease.
think my HDL was high.
So that would be good.
Okay.
So that's protective.
Yay.
The LDL is the bad cholesterol.
Okay.
That we want low because
Okay.
we know that when that goes up, that the risk for heart attack is increased.
And does that mean that I'm building plaque and possible blockage?
It could mean
Okay.
that over time, that blockages can form. And actually, they've looked at aortas, which is that big tube that runs down the body. Even at a young age, 15, 16 years old, people are developing plaque
Got it.
as soon as that. So that's a long chronic process.
Okay.
So the other thing we look at is, you mentioned the VLDL, that's the very low density lipoprotein, and that is one of the subparticles of LDL, and that can be elevated as well, and that's not good. So we
Okay.
want that low. The triglycerides are how much fat you have in the blood.
Okay.
That's why it's important to do these tests fasting, because if you have a lot of, let's say you just ate ice cream, your triglycerides are going to be through the roof. So that's why we have to hold off for 8 hours prior to doing the testing.
Got it.
And when you do so, if the triglycerides are still high, it depends on how high, we try to either use diet and exercise, or if it's really elevated, there are some medications to help with that as well.
And that's called the statin.
The statin can help with the elevated triglycerides or the fat, but there are other medications,
Okay.
like fibrates. For the statin, that actually helps with the bad cholesterol.
Got it.
It helps reduce the bad cholesterol. We always try to combine that with diet and exercise.
So, but there's also a large conversation about fish oil. Does that also, 2,500 milligrams of fish oil every day lowers your cholesterol? Is that hand in hand with the statin and everything else that you're talking about?
Right. So the statin is going to be your primary medication.
Okay.
And it's not just good for lowering your LDL or the bad cholesterol. It also helps reduce inflammation in the arteries of the heart.
it.
And it also reduces the risk for a plaque to rupture, which is what causes a heart attack.
Got it.
So it actually does all three of those things. The statin is the primary therapy. The secondary therapies like fish oil have actually picked up some steam. There was a recent trial that came out that showed that it does help with reducing cardiovascular events in specific patients, things like patients like diabetics, patients who have had a history of heart attack. So it's very specific indications for that have actually been shown to help. It is also a very mild blood thinner.
Okay.
So if someone's already on blood thinners, I tell them to be cautious with that. With the fish oil, there's actually been studies that have shown that there's specific formulations of fish oil that help and others don't. So that's why it's very important to speak with your cardiologist to get that specific fish oil. Other things to consider are exercise.
Exercise.
So we want to exercise for about 150 minutes a week.
Okay.
And that's with aerobics, moderate intensity, brisk walking.
For all of you that say, oh, I don't have time to work out, walk up and down the stairs. Instead of sitting at your desk having lunch, get up, go out, and raise your blood pressure.
It's difficult.
Raise your heart rate.
Yeah, it's very
Okay.
difficult to put all that time aside to exercise, but again, this is all for heart health. And if
Okay.
there are risk factors, we want to reduce those as much as possible, and we want people to live as long as possible. So exercise and diet, those are key.
And sleep.
Sleep is important. Low stress.
Low stress.
Stress is a big risk factor as well in and of itself. And it's important to try to maintain a stress-free lifestyle. And again, stress can also cause a lot of chest pain. We see that constantly in cardiology, a lot of anxiety. But these things could also be associated with heart disease. So it's very important to be thorough and do a full evaluation.
Doctor, what's your final sentence in heart health? How to keep your heart healthy?
heart health is a chronic preventive process. It's nothing that you can do overnight. So it's important to start right away. Put away the smoking, try to exercise and maintain that good diet, because over time these things can affect the heart, and really we want everyone to be as healthy as possible. So if there ever is a concern, then you should definitely see your physician right away, and of course if someone is very concerned, an emergency department.
Such a pleasure having you. Thank you
you
so much. Okay, so you heard it from Dr. Rostamian. Pay attention, ask questions, find out your family history, talk to your parents, talk to your family. You only got one heart, so make it healthy. You can find us on all types of social media. On Facebook, we're at AH Glendale, LinkedIn, Adventist Health, and you can always visit the website, AdventistHealthGlendale.org, and I'm always on at Gregory Zarian. Remember, the most important conversation you're going to have is about you and your health, so why not start one now? We'll see you next time. Thanks.